Welcome to the Aesthetic Doctor Podcast. We don't shy away and keep secrets here. We empower you with education, telling you the truth about all things aesthetic medicine while encouraging you to be the best version of yourself. It's time to look great and feel good doing it. This is your host, mom, speaker, and board-certified physician, Dr. Borger.
Hello, friends, and welcome to episode 15 of the Aesthetic Doctor Podcast. We have another super duper expert today, and we have Dr. Elizabeth Chiang, and she is an ophthalmologist, board certified. And further than that, she is a fellowship trained oculoplastic and reconstructive surgeon. What that means is that not only did she do 4 years of a eye or ophthalmology residency, she spent an additional 2 years just getting further training and surgeries that are either plastic or reconstructive for around the eye, such as eyelid surgery. So she actually specializes in eyelid surgeries, and that is what she's here to talk to us about. Today's episode is all about eyelid surgeries. She does eyelid surgeries for both cosmetic and medical reasons. And so please join me in welcoming Dr. Chiang. And here you go, jumping right into our conversation on eyelid surgeries. So, Dr. Chiang, I'm so excited that you're here today. And, I in my office only do non-surgical aesthetics. So I actually refer or sometimes have to kind of recommend surgical approaches to my patients because I really well know my limitations. And I think blepharoplasty is probably the one that I refer patients most for, simply because I feel like I have a lot of patients in my office, especially as they age, they feel like their eyelids are heavy, they have extra tissue. And then the thought is always like, oh, let me just get some Botox for everything. But then after I examine them and I sort of recognize the limitations of what I can do non-surgical, I think me recommending them to really talk to an expert such as yourself about blepharoplasty is probably the most common referral that I do. So especially for my listeners, I think this will be super interesting. Talking about blepharoplasties, can you just give us an overview of what sort of the different eyelid surgeries are that you do?
Yeah, so blepharoplasty is specifically taking off that extra eyelid skin. So the eyelid skin is the thinnest skin on the body. And so it does stretch with time and, loss of collagen. So with pure blepharoplasty, really, it's just taking off extra eyelid skin and sometimes the underlying muscle and fat as well. If there's little bulges in the eyelid, taking out that fat can also help improve the appearance. If someone's eyelid is especially low, that might be due to the muscle that lifts the eyelid called the levator aponeurosis, kind of slipping back and not being able to pull the eyelid as much. So that can be corrected through something called ptosis repair, which can be done at the same time as blepharoplasty. And typically, there are different techniques for it, but probably my most used technique is actually advancing that muscle and because it's slid back to actually suture it back to where it needs to be in order to really open up the eyes more.
Awesome. Yeah. And that's really kind of like, I wish we had like models here, but it's really just kind of that extra tissue, like right up in the upper eyelid that most people kind of feel with age, just like you said. Now, some of my patients might not know this, but these are all in-office procedures, right? Where people go home the same day. Can you talk a little about the downtime and how long the procedures take and what people can expect if they're kind of considering a blepharoplasty?
Yeah, so blepharoplasty can be done in the office or it can be done in the operating room, and that's really the preference of the patient as well as what equipment and facilities the surgeon has. So I've definitely done blepharoplasty in a procedure room for patients who are able to kind of tolerate the numbing process. So basically, I numb up the eyelids by injecting an anesthetic, lidocaine with epinephrine. Mixed with marcaine with epinephrine, and that numbs it up. So the medication, when it goes in, it does burn, but that burning just lasts for a few seconds, and then that anesthesia sets in. And while you may still feel touch, you're not going to feel pain anymore. Then part of surgery is just removing all that extra tissue. There can be some cautery, which is applying heat in order to stop bleeding as well as shrink fat. And then afterwards, after taking all that tissue out, just suturing it closed. And that can be done with a suture that's dissolving or a suture that does have to be removed later. And they're kind of pros and cons to each of them, those techniques. And so for people who may not be able to tolerate, the pain of the injection or tolerate lying down, because you do need to lie flat for me to do this. So some people have, back issues where lying down flat for a while might be a problem. Then I take them to the operating room. It's still outpatient, but then you can get an IV, you can get anesthesia, you can be made to be a little bit more sleepy. You can get, other medications to help with muscle relaxation and anxiety. And so a lot of patients do end up preferring to go to the operating room. But of course, there's additional costs for that operating room and anesthesia.
Yeah, I mean, I guess thank you for clarifying that. What I mostly meant was that it is an outpatient procedure. In terms of the downtime, what do most patients kind of, in your experience, what is the normal downtime like? And are there any effects on vision initially? How long can people not drive? Kind of those things as far as daily life downtime.
Yeah, so if it's done in the office or done in the outpatient surgery center, I do recommend someone else do the driving for the day of the procedure. Obviously, if you're in the OR and you're getting anesthesia through your IV, you definitely cannot drive. Yes. But even if you don't get the anesthesia through IV, you don't want to drive after a procedure like that. You want someone else to take you home because, for the next 2 to 3 days, you're going to have swelling, and that swelling is going to get worse actually for about 2 to 3 days, and then it'll start to get better. So most important thing is just lots and lots of ice or cold compresses during those first 3 days to really keep that swelling down. Because, if you have a lot of swelling, that can actually stretch out the skin a little bit more afterwards. I've had patients who actually, had their surgery done on a Thursday or Friday, and then actually did go back to work on Monday after icing, really constantly. Wow. But those are people usually who have like desk job type work or, with COVID working at home. And so no one's really seeing them because you are still going to be, definitely swollen on day 3. I say on average, 80% of that swelling is gone after 2 weeks. I've had patients who, when they're really good about the icing, they basically look fully healed at 2 weeks. I had one patient who didn't follow any instructions and didn't do any icing, and she was swollen for at least a month after surgery. So that ice is super important.
Like everything else, right? We want our patients to kind of listen to us and follow our advice because we say most of the stuff for a reason, not just because we feel like it.
Yes, definitely. So I would say, a lot of my patients go back to work after a week, but no heavy lifting or deep bending for 2 weeks after surgery. And, at 1 week, you're still going to have signs of swelling. So it depends on what kind of job you have. If you're, in front of clients or people that you don't want them to kind of see that you've had recent surgery, then I would say you want to take 2 weeks off of work.
Yeah, that's really doable though. So we talked a lot about sort of the upper eyes. I know, obviously there's upper and lower eyes, and the lower eyes, especially when people have like that big bulge of the lower eyelid. What can you tell us a little bit more about lower eyelid blepharoplasties?
Yeah, so lower eyelid blepharoplasty, sometimes it is extra skin, but a lot more it is that fat that's coming forward. So we have a tissue called the septum that kind of holds the fat back. And as we get older, it just, thins out. It's not as strong. And so those fat pads start coming forward. Also, because we live in a world of gravity, things start descending. So, your muscles and your teeth can start descending down. And so that can also create even a hollowed look underneath your eyes. So lower lid blepharoplasty is definitely a more involved surgery than upper lid blepharoplasty. And so that is done in the operating room. It is an outpatient procedure, so you still go home the same day. But typically I will put people completely asleep with like general anesthesia for a lower lid blepharoplasty, because I'm really pulling up a lot of tissue and doing a lot more manipulation. But the postoperative care is typically the same. It's still really just icing, lots of ice for 3 days, and typically looks good at that 2-week mark.
Awesome. Now, if people are considering the procedure, what would you recommend they kind of look for in a surgeon to perform that procedure for them?
Yeah, so if you're really just looking at eyelid surgery, I really do suggest an oculoplastic surgeon. So I do have lots of patients who come and say, well, why wouldn't I go to a plastic surgeon? Well, as an oculoplastic surgeon, I am a plastic surgeon, and my training is So 4 years of ophthalmology residency, so just all about eyes. And during that time, I'm already doing eyelid surgery because eyelid surgery is part of, the eye region. And then I did an extra 2 years of fellowship training just specifically on the eyelids and area around the eyes. So compare that to a plastic surgeon who does a 6-year residency, but they're doing the entire body, right? They're doing skin grafts, they're doing breast augmentation, breast reduction, tummy tucks, really the entire body. And so depending on their training, they may not do that many eyelid surgeries during their training. But, I spent 2 years just eyelid training, and just doing surgery on eyelids and operating 4 to 5 days a week. So it's a lot more specific training to the eyelids. The knowing the anatomy to the eyelids, I think, is really important for all this.
Yeah, I mean, I'm so glad you kind of mentioned that. And, when I tell people like we have true experts here, Dr. Chiang is somebody who really spent 6 years essentially just training to be where she is. And then, the training never stops, right? Like if we are really on top of our field, we do continuing medical education all the time. We kind of advance our surgical techniques. We keep up with the literature. And, your entire focus is in the eyes. So I completely agree with you. I think people should seek out oculoplastic surgeons. And, one of the ways I sometimes describe it to people is like, this is really expensive real estate up here, like your eyes really, really matter. So thank you again for really telling us in depth how much training really went into you getting to where you are. Now, some of the other things that you've kind of mentioned is a little bit of the hollowness and all of that stuff. I assume you sometimes combine doing blepharoplasty with Botox and fillers?
Yes, definitely. So, so when you do fillers, then usually you do have to continue to do fillers if they're hyaluronic acid, because that does absorb with time. You can also do fat grafting actually at the time of surgery, and so with that fat grafting, some of that fat is going to absorb, but some of it does stay around and it's essentially permanent.
Where do you get the fat from in your practice?
Usually I go down the side of the thigh.
Okay, from the thigh. Okay.
Yeah, it doesn't take a lot of fat to fill.
Yeah, no, it's just a little bit. I just always wonder because sometimes, like for other surgery, people take it from like the bellies or the buttocks or wherever. So I guess it's more like an interest thing where you like to go. So it's really the side of the thigh. But how much fat do you think you harvest?
Yeah, I mean, not maybe like 20 cc's. It's really not.
I'm sure people would love for you to take more. Most people is like, while you're there,
Yeah, I mean, the reason I do the side of the thigh is just it's a small incision, easy to hide. There's plenty of fat there. I mean, basically, you're not going to notice any loss of fat from the amount of fat I'm taking. But there's no like nerves there that I'm worried about. So it's very safe area just to take a little bit of fat.
Awesome. And you also do brow lifts. So tell us like what a brow lift is and how would people, other than, of course, we always recommend everybody get a consult, but how would sort of the average person know, do they need a brow lift or do they need a blepharoplasty?
So sometimes people do need both. So the brows, if they descend and they're really rather low, then that's also going to change the appearance. And so this actually I think happens a little bit more with men because they have heavy brows. But if your brows are below what's called your orbital rim, so if you actually touch your face, you can actually feel that rim. And if the brow hairs are kind of falling below that, then you could probably benefit from a brow lift. And there are a lot of different ways to do brow lifts. Some are more invasive and bigger surgeries, and some are kind of smaller surgeries. So depending on how much lift you need and how much you want to do, it's going to depend on what technique is kind of offered to you. There's something called an indirect brow lift that can be done at the time of the blepharoplasty or ptosis repair, where basically you're just putting some sutures under the brow to support the brow up. So it's not a huge lift, but if you just have a slight droop, or you don't have that nice arch of your brow, that can get the brow arch back, and that's really like just minimal extra time and anesthesia, very kind of a much simpler procedure. Probably the biggest procedure would be an endoscopic brow lift, where you're actually making incisions in the hairline and using endoscopic tools to actually dissect the entire forehead and then pulling the entire forehead up. So that also pulls the brow up. And so that is definitely a much bigger surgery. Um, there are other types where there's something called a direct brow lift, where you actually make an incision above the brow, but that can leave a scar, and typically not something I do for cosmetic patients, though. I have actually on a few select patients, like one who always wore bangs, and so it would cover that incision, and she was actually uneven between her two brows. So that particular technique is the easiest to get asymmetry to become symmetric when you're just operating on one side. Uh, and actually she healed really well. There was really minimal scarring, very easily covered by the way she kept her hair. And and I talked to her about like, well, what if you decide not to have bangs? She's like, I've been wearing my hair like this for a decade, it's not changing. So she was very happy with the results on that. But typically I reserve direct brow lifts more for like men who have kind of bushy eyebrows. You can really hide that scar much easier. And then there's also like a coronal brow lift where you actually make a large incision in the hairline as well. And instead of just endoscopic, but you can actually get more of a lift because you can actually cut out some of the scalp and really pull it up. Whereas with endoscopic, you're not cutting out tissue, you're just dissecting under the tissue and then pulling it up and then putting new sutures to anchor it there.
Super interesting. And that really also underscores two things. Number one, you really need a consultation, and then it has to be a joint conversation between what your goals are, what your surgeon can do. And if you seek out an expert, they know all these techniques, they have all these tools. So there's not just one way they do it. They really can decide with you to do it the best way for your anatomy and your goals. When I read on your website, so first of all, we're going to link later in the show notes, but Dr. Chiang has a fabulous website called dreyelid.com, and there's some before and afters also, so people can really see what the different procedures can do. But I saw that you do permanent reduction of or removal of eyelashes, and I guess I was fascinated by that. Why would somebody want to permanently remove their eyelashes?
So if their eyelash is growing away, such as touching the surface of their eye, that can cause a lot of discomfort. And so that's typically why people get their eyelashes taken out. It's an eyelash that's growing the wrong way. It's an abnormal eyelash.
So permanent removal is then permanent, right? And it's really just for medical reasons, of course, not cosmetic reasons. What do those people do then without eyelashes? Or is it just select few that will grow that way?
Luckily for most people, it's just a select few and not a lot of eyelashes. But unfortunately for some people, it will be a lot of eyelashes. There are conditions where sometimes you can actually operate on the eyelid and turn the eyelid out, so it no longer touches the eye. But then some people aren't really candidates for surgery for whatever reason, especially kind of older patients, and so they may elect to just have the eyelashes permanently removed instead of having a surgery to actually turn the lid back into proper position.
Yeah. And again, for lay people, the reason that will be a problem is obviously that the eyelashes growing the wrong way would irritate the actual eye, correct? And cause little abrasions and all of that stuff.
Yeah, exactly. If something touches your eye constantly, that's very uncomfortable.
Yeah. So I love the overview that you gave us. Something I asked a lot of my patients, a lot of my guests is what is your favorite procedure to do? I know we love them all. That's why we picked the field, but what is the one that every time you see it on your schedule, you go, I love doing this?
I really do actually love doing upper lid blepharoplasties. It's, they're, I don't want to say easy to do, but kind of in the gambit of all my surgeries, they are one of the kind of simpler procedures, and they just get great results, and patients are usually really happy afterwards. So it's kind of
I guess that is an awesome procedure, right? They're not, that you have a good success rate and everybody's happy. What's not to love about that, right?
Right.
Now I know you in the realm of aesthetics, do you have a favorite procedure to receive? What is your favorite procedure to get done on yourself?
So I do inject my own Botox to myself.
So it's you injecting your own Botox.
Yeah.
Yeah, I agree. That is my favorite. I feel like Botox is just the bomb. Well, awesome. Thank you so much for giving us this overview. That was really, really great. I've mentioned your website. If people are interested, where can they find you?
Yeah, best thing is just to go to my website, www.dreyelid.com. and that'll always point you to where I am at.
Perfect. Well, again, thank you so much. It was such a pleasure to have you. And, thank you for sharing with us and for doing all the great things for your patients.
Hey, thanks for having me.
Thank you for listening to the Aesthetic Doctor podcast with Dr. Judith Borger. We'd love to connect with you outside of the show. Follow Dr. Borger on Instagram at Dr. Borger and find more online and ways to work with Dr. Borger at www.theaestheticdoctor.com. Until next time, be well.